Okay, so getting ready for a colonoscopy can be a little bit intimidating.
Yeah,
But you know what's also a really important step in taking care of your health?
absolutely.
And today we're going to unpack everything you need to know about the CLENPIQ split dose method
Okay.
for colonoscopy prep so you can feel confident and prepared every step of the way. We've got your doctor's instructions
Right.
and some helpful videos, and we're going to break it all down for you.
Yeah, it's a bit like having a personalized guide
You
for your
say,
prep journey.
so first things first, why is all this prep even necessary? I mean, it's
Okay.
not exactly the highlight of the experience, right?
It's true that the prep often gets a bad rap,
Yeah.
but it's absolutely crucial for a successful colonoscopy.
Okay.
Think of it this way. The cleaner your colon, the clearer the view for your doctor during the procedure.
Ah, okay.
And a clear view means they can spot and remove any polyps, those little growths that can sometimes develop into colon cancer.
So a good prep could actually help prevent something serious down
Absolutely.
the road.
Yeah, and a good prep also means you're less likely to need another colonoscopy
Okay.
anytime soon.
So let's dive into the specifics of the CLENPIQ split dose method. What does split dose even mean?
It means you'll be taking the prep solution in two separate doses. One dose the evening before your colonoscopy,
Okay.
and the second dose on the morning of TAY. Your doctor chose this method for you, and based on the materials they provided, it seems they've been careful to select a prep that's known for being both effective and relatively easy to tolerate.
That's reassuring.
Yeah,
So you'll have 2 bottles of this CLENPIQ liquid, and it's super important to follow those instructions carefully.
precision is key here. And here's something that might surprise you. The prep process actually starts 3 days before your colonoscopy.
Wait, 3 days? I thought it was just the day before.
Nope, 3 whole days. It's all about gradually easing into it.
So what does that look like? What changes do I need to make 3 days out?
It starts with your diet. You'll need to avoid certain foods that can linger in your digestive system and make it harder for the prep to work its magic.
Okay, so give me the rundown. What's on the no-no list?
Starting 3 days before your colonoscopy, say goodbye to Metamucil vitamins containing iron and raw vegetables. Corn and sesame seeds are also off the menu, as are foods with skins or small seeds. That means things like tomatoes, kiwi quinoa, and cucumbers.
Got it. No roughage allowed.
Exactly. And you'll also want to discontinue any fiber supplements during this time. Fiber is great for everyday digestion,
Yeah.
but it can actually interfere with the colonoscopy prep.
So it's all about simplifying what goes in so it can come out more easily later.
Precisely. And speaking of things going in, let's talk about hydration.
Right. The materials really emphasize staying hydrated.
And for good reason, staying hydrated is essential throughout this entire process, starting 2 days before your colonoscopy. Aim to drink 4 extra 8-ounce glasses of clear fluids each day.
So water, clear broth, things like that.
You got it. And there's also an optional step your doctor mentioned,
Okay.
taking an over-the-counter laxative 2 nights before the procedure.
Is that for everyone or just certain people?
It's mainly for folks who are prone to constipation. It's not required, but it can help get things moving along more smoothly. Think of it as giving your system a little nudge in the right direction.
Okay, so 3 days out, dietary adjustments, extra hydration, and maybe a little laxative if needed.
Yep.
What happens the day before the colonoscopy?
Now things get a bit more serious. The day before your colonoscopy is a clear liquid-only day.
So no solid food whatsoever.
Nope, not a bite. But the good news is that clear liquids include a lot more than just water. You've got options.
Okay, I'm all ears. What are some examples of things I can enjoy?
Think clear broth, apple juice, white grape juice, basically any fruit juice without pulp.
Okay.
You can also have sports drinks like Gatorade as long as they're clear, and even Jell-O and popsicles again without any pulp or fruit pieces.
So there's room for flavor and a little treat even during prep.
Exactly. Just remember to steer clear of anything red, blue, or purple, as those colors can interfere with the colonoscopy.
Got it.
And of course, no milk or creamy beverages.
Got it. So clear liquids only and lots of them. What about the CLENPIQ itself? When does that come in?
You'll take your first dose of CLENPIQ at 5 p.m. the day before your colonoscopy.
Okay, so what does that look like?
You'll drink the entire 5.4-ounce bottle, followed by 48 ounces of clear fluids over the next 6 hours.
Wow, that's a lot of liquid. Any tips for making that more manageable?
Here's a little trick. Try using a straw. It can help with the taste.
That's a great tip. I'm definitely going to remember that one. Is there anything else people should be aware of at this stage?
You might experience some bloating or discomfort after taking the first dose.
Yeah.
That's perfectly normal, but if it becomes severe, it's best to delay the second dose and reach out to your doctor's office.
Always better to err on the side of caution. Okay, so we've covered the 3 days leading up to the colonoscopy and the first dose of CLENPIQ. What happens on the day of the procedure itself?
That's when you'll take the second dose of CLENPIQ and enter the final fasting period before your colonoscopy. But before we get into those details, let's take a quick break. We'll be right back with the rest of your personalized prep guide. All right, so we left off talking about the first dose of CLENPIQ and what to expect in the days leading up to your colonoscopy. Now let's fast forward to the morning of the procedure itself.
Okay, so it's the big day.
Hmm.
What's first on the agenda?
First things first, no breakfast allowed.
Mm-hmm.
This is going to be a clear liquid-only day.
Got it. No sneaky snacks before the big show.
Hmm.
So when do I tackle that second dose of CLENPIQ?
You'll want to start that 5 hours before your scheduled appointment time. And I want to emphasize this 5 hours before your appointment time, not your arrival time.
That's a good point. If my appointment is at 10 a.m., I need to start that second dose at 5 a.m. sharp, even if I don't need to be at the clinic until later.
Precisely. Just like the first dose, you'll drink the entire bottle of CLENPIQ. This time you'll follow it with 32 ounces of clear fluids over the next hour.
So that's 4 8-ounce glasses. A good rule of thumb seems to be dose of CLENPIQ, then lots of clear liquids to help move things along.
Exactly. And after you finish those fluids, you'll enter a critical 4-hour fasting window before the procedure. Absolutely nothing by mouth, including water, gum, mints, anything at all, except for essential medications that your doctor has approved.
Wow, no cheating on the fast. Why is that 4-hour window so important?
It's all about safety. This fasting period ensures that your stomach is completely empty during the procedure. Otherwise, there's a risk of aspirating stomach contents into your lungs while under anesthesia, which can be very dangerous.
Okay, that makes sense. Safety first. But what about people with diabetes? They need to be really careful about their blood sugar levels, especially with fasting.
You are absolutely right. The prep process for diabetics does require some careful planning and adjustments to medication regimens.
So what's the general advice for people with diabetes who are prepping for a colonoscopy?
The good news is that colonoscopy prep is safe for diabetics if they follow the instructions carefully and work closely with their doctor. The main concern is the risk of hypoglycemia or low blood sugar, which can happen because of the dietary changes and fasting periods.
So monitoring blood sugar levels closely is key here.
Absolutely. And it's really important for our listeners who have diabetes to talk to their doctor well in advance of the procedure. They'll be able to provide personalized instructions on how to adjust their medications safely.
It's all about personalized care, isn't it?
Uh-huh.
So what are some general recommendations for common diabetes medications?
Well, for those taking metformin, the advice is to stop taking it when the clear liquid diet begins and resume once you're back to eating regular meals after the procedure.
So essentially pause metformin during the prep and fasting periods.
Yeah.
What about medications like semaglutide, which includes popular brands like Ozempic and Wegovy?
There are specific instructions for those medications depending on whether you take a daily capsule or a weekly injection. If you're on the daily capsule, you should stop taking it 24 hours before the exam. If you're on the weekly injection, you should stop a week before. Then you can resume taking it at your normal dose after the procedure.
Okay, so there's a bit more nuance with semaglutide. What about other GLP-1 receptor agonists like Trulicity or Byetta?
The general recommendation for those medications is similar to metformin. Stop taking them when the clear liquid diet begins and resume once you're back to eating normally after the procedure.
Okay, so pausing these medications during the prep and fasting seems to be the general approach.
Exactly. Now, for those using rapid-acting insulin, they may need to adjust their dosage based on their usual insulin-to-carb ratio, since they'll be consuming fewer carbs during the prep.
And what about those who use fixed doses of insulin for each meal?
They will likely need to significantly reduce their usual dose during the clear liquid prep phase as well.
Got it. And basal insulin.
The general recommendation is to reduce the basal insulin dose by 20 to 50% starting the day before the procedure. But again, the exact adjustment will depend on the individual's insulin regimen and their doctor's recommendations.
So it's crucial for anyone on insulin to have that detailed conversation with their doctor to create a safe plan for managing their blood sugar levels throughout the process.
Absolutely. Personalized care is key here.
Okay, so we've covered the dietary adjustments and medication considerations, but let's get real for a second. A lot of people get anxious about the, shall we say, bathroom situation during the prep.
I understand. It's not the most glamorous part of the process, but it's important to remember that frequent trips to the bathroom are a normal and necessary part of effectively cleansing your colon.
Right, it's all part of getting ready for that clear view during the colonoscopy.
Mm-hmm.
So what can our listeners realistically expect in terms of, well, bowel movements?
The CLENPIQ solution is designed to induce diarrhea, which is how it cleanses your colon. You can expect frequent watery bowel movements that might start as soon as an hour after taking the first dose.
And is it pretty much nonstop from there?
The frequency and intensity can vary from person to person, but yes, you should plan to stay close to home and within easy reach of a bathroom for the duration of the prep.
Okay, so no last-minute grocery runs or social outings during prep. Got it. Any tips for managing those bathroom breaks?
Absolutely. First, make sure you've got plenty of soft toilet paper and soothing wipes on hand to minimize any irritation. The materials even recommend baby wipes as they tend to be gentler on sensitive skin.
That's a good tip. I wouldn't have thought of that.
It's the little things that can make a big difference in comfort. And you might also want to have some diaper rash ointment or zinc oxide cream on hand in case you experience any skin irritation.
That's smart.
Yeah.
Anything else to make those bathroom breaks more bearable?
Turn it into a little retreat, grab some reading material magazines, or even your favorite streaming device to keep yourself entertained. Think of it as a chance to catch up on things you've been meaning to do.
Okay, I like that bathroom spa day with a side of entertainment.
Exactly. It's all temporary, and if you plan ahead and prioritize your comfort, it's definitely manageable.
Well said. And remember, those frequent bathroom trips are all in service of a greater goal, a successful colonoscopy that can help protect your health in the long run.
You've got it. Now let's talk about what happens after the colonoscopy itself.
Right, the prep is just the first part of the journey. What can people expect in terms of recovery?
Most people feel a little groggy and disoriented immediately after the procedure because of the sedation. That's why it's so crucial to have a responsible driver to take you home safely.
Absolutely. No driving after sedation.
Exactly. And once you're home, it's best to take it easy for the rest of the day. No strenuous activities or heavy lifting.
Some more lounging and relaxation. Sounds good to me.
You might also experience some mild abdominal cramping or bloating, which is totally normal.
Anything I can do to ease those symptoms?
Hydration is your friend here. Sipping on clear fluids throughout the day can really help.
Hydration, the MVP of colonoscopy.
Yeah.
What about food? When can I start eating again after the procedure?
You can usually start with light, easily digestible foods as soon as you feel up to it.
So things like toast soup or crackers?
Exactly. And then you can gradually reintroduce more solid foods over the next day or two.
So it's kind of like reversing the prep diet.
You could say that. And it's generally best to avoid anything spicy, greasy, or high in fiber for the first day or two, as these can irritate your digestive system.
Bland is best at least for a little while.
Right. And it's also best to avoid alcohol for at least 24 hours after the procedure because it can interact with any lingering sedation medications.
Okay, so lots of rest, hydration, bland foods, and no alcohol. Got it. Anything else to keep in mind during recovery?
It's always a good idea to pay attention to your body and let your doctor know if you experience any unusual or concerning symptoms.
Like what kind of symptoms are we talking about?
Things like severe abdominal pain, fever, bleeding, or persistent vomiting.
Okay, those sound like definite reasons to call the doctor.
Exactly. It's always better to err on the side of caution and seek medical advice if you're experiencing anything out of the ordinary.
Makes sense. Now, we've talked a lot about the physical aspects of colonoscopy prep, but I think it's important to address the mental and emotional side of things as well.
You're absolutely right. The physical aspects often get the most attention, but the emotional and psychological impact can be significant too.
It's natural to feel some anxiety or apprehension about the procedure, and the prep process can feel especially daunting for some people.
Absolutely. The thought of cleansing your colon and experiencing diarrhea can be uncomfortable, and there's often a sense of vulnerability associated with this type of procedure.
It's not something people usually talk about openly, which can make it feel even more isolating.
You're right. There's a bit of a stigma surrounding bowel movements and digestive health, but it's important to remember that these are normal bodily functions and everyone experiences them.
So what are some ways to address the psychological side of colonoscopy prep? What advice do you have for our listeners who are feeling a little anxious about it?
First and foremost, acknowledge your feelings. It's okay to feel anxious or even a little embarrassed. Don't try to bottle those emotions up.
Give yourself permission to feel what you're feeling.
Exactly. Talk to someone you trust about your concerns.
So even though colonoscopy prep might not be something we all look forward to,
Right.
it's so important for staying healthy and preventing colon cancer.
Hopefully this deep dive helped answer some questions and maybe alleviate some anxieties and empowered our listeners to approach their colonoscopy with confidence.
I hope so too.
Yeah. And before we sign off, I want to give another shout out to the Center for Digestive Health and Nutrition. Their website is an amazing resource for anyone who wants to learn more about digestive health, with tons of information, articles, it's all there.
So big thanks to them for all the great work they do.
Yes, thank you.
And remember, if you have any concerns or questions, you can always reach out to your doctor.
Absolutely.
They're your best resource for personalized guidance. Thanks for joining us on this deep dive into colonoscopy prep.